Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on anatomical landmark sphenoid sinus. Okay, so sphenoid sinus is basically a air cavity within the body of sphenoid bone. So this is the sphenoid bone and these two lobes which are seen is nothing but the sphenoid sinus. Okay, this is the sphenoid sinus, this is the septa of sphenoid sinus that is seen, and here's the sphenoid sinus as seen in the axial section, coronal cross section and the sagittal cross section. Okay, so it is basically a midline structure that is located anterior to the clevis. This is the clevis. So sphenoid bone is located anterior to the clevis and posterior to superior meatus of the nose. So here somewhere in this region is the nasal region, and this is the sphenoid sinus. Because it's a 4 by 4 FOV, that is a small FOV scan, so hence the nasal structure is cut, but it is located posterior to the superior meatus of the nasal cavity. So somewhere in this region is the nasal cavity. Okay, here is the nasal cavity and it is located superior to uh, uh, it is located posterior to superior meatus of the nasal cavity, and this is the clevis. Okay, so this is the sphenoid bone. So basically, why sphenoid sinus is important, because here mostly sinusitis can also occur. So how we'll come to know about the sinusitis part: patient may have throbbing pain and pressure around the eyeball, which may mimic because of the dental pain also. So one has to also consider taking scans of the sinus. So in case if the patient has dental pain referred to eyes or something, so we have to check the sphenoid sinus as well. And also by asking the patient some history, like bend down, whether the pain increases or decreases while bending down, earache, neck pain, or pain in the eyes. So why this sphenoid sinusitis is important, because though it is rare, but it may lead to potential devastating complications such as cranial neuropathies and cavernous sinus thrombosis, meningitis, and intracranial abscess. Now we'll see the sphenoid sinus in different cross sections. Okay, so likewise we can just have a look at it. This landmark which is seen is nothing but the pituitary gland. Okay, so we can see pituitary gland here as well. So this is the pituitary gland, and this is in case of sinusitis, all these radiolucent structures will be covered by some kind of radiodense grayish color, or you can say hypodense areas with some mucosal lining thickening or increased air fluid level. And as you can see, this is the coronal CMPR. You can see the sphenoid sinus over here. In case of sinusitis, again it will be filled by some kind of mucosal fluid or lining thickening. Okay, so now what is the reason behind sphenoid sinusitis? Either it could be caused due to some kind of bacterial or viral infection, which may impact the upper respiratory tract, and other possible factors are like weak immune system, tooth abscess, which is very important, nasal polyps, maxillary sinus polyps, and nasal defects, and enlarged adenoids. And hence we have to consider sphenoid sinus during such cases, and hence imaging needs to be done. Okay, so whether the sinus thing is treatable or not, so yes, it can be treated surgically and through endoscopic splenectomy as a preferred treatment, and no home remedies as such except for the steam inhalation. But definitely you require an ENT surgeon, or firstly the dentist and then the ENT surgeon, mainly the ENT surgeon, to be taken into consideration. But it cannot be treatable just by home remedies. So one has to consider also one has to consider other treatment modalities if required, such as MRI scan, but may not be very much helpful. So you can just check it once with the MRI scan with your radiologist as well. Okay, so this was everything about sphenoid sinus. Okay, thank you so much.